You are shorter than you were this morning, by 1 to 2 centimeters. You lost that height across the day, gravity compressing the 23 intervertebral discs in your spine under 500 to 800 newtons of continuous downward force since the moment you stood up. The discs are hydraulic cushions, gel-filled pads between the vertebrae that absorb shock and permit movement. Gravity squeezes fluid from them the way standing on a sponge squeezes fluid from them, the way standing on a sponge squeezes water out. By evening, the sponges are thinner. You are measurably, physically shorter. Tonight, when you lie down, the compression will stop and the discs will slowly draw fluid back through osmosis. The overnight rehydration the spine discussion described. By morning, the height returns. The cycle repeats tomorrow. Compress all day, rehydrate all night, every day of your life. There is a way to interrupt the cycle during the day, to decompress the discs while standing, while awake in 30 seconds, using nothing but a horizontal bar and the same gravity that compressed them. Rip the bar overhead, lift your feet from the ground, and in the instant your body weight transfers from your feet to your hands. The gravitational vector acting on your spine reverses. The force that was pressing your vertebrae together is now pulling them apart. You do nothing. Gravity does the work. 30 seconds. What happens during those 30 seconds involves not just the spine but the shoulders, the grip, and the thoracic cage. 4 structures simultaneously receiving the opposite of what they have been receiving all day. Now, the discs, because the traction physics is more specific than the word decompression suggests. When you hang with your body weight suspended from your hands, the vertebral column is subjected to axial traction, a pulling force along the longitudinal axis of the spine. Your body weight minus your arm weight provides the traction force. For someone weighing 75 kilograms, approximately 60 to 65 kilograms of traction is applied to the lumbar spine, far more than any manual therapy technique can produce with hands alone. Under traction, intradiscal pressure drops. The vertebral bodies separate slightly, fractions of a millimeter per segment, but across 23 discs, the cumulative effect is measurable. Spinal traction produced measurable increases in intervertebral disc height and decreases in intradiscal pressure within minutes of application, as Giannakopoulos and colleagues demonstrated using MRI. The decompression provides a fluid exchange cycle during the day that the discs do not otherwise receive until nighttime sleep. 30 seconds of hanging in the afternoon, when spinal compression is maximal and the discs have lost the most fluid, provides a partial rehydration window that would otherwise not occur for another 4 to 6 hours. The decompression follows a specific timeline that reveals what is happening inside the disc at each stage. During the first 5 to 10 seconds, the traction separates the vertebral bodies and reduces the compressive load on the nucleus pulposus, the gel core of the disc that bears the majority of the axial force. The intradiscal pressure drops from its loaded value toward its resting baseline. The disc is no longer being squeezed. During seconds 10 to 20, the reduced pressure creates an osmotic gradient. The proteoglycans in the nucleus are hydrophilic molecules that attract water, and with the compressive load removed, they begin drawing fluid from the surrounding vertebral end plates and annular tissue. The disc is actively pulling water back in. During seconds 20 to 30, the cumulative fluid uptake produces a measurable increase in disc height, fractions of a millimeter per segment, but across the lumbar spine, the total increase is sufficient to widen the foramina and reduce nerve root compression. Comparison to astronauts is instructive, and the comparison is not an exaggeration. Astronauts in microgravity gain 3 to 5 centimeters of height during the first days of a space mission, because the continuous removal of gravitational compression allows full spinal disc rehydration around the clock. The height gain produces back pain. The discs swell beyond their accustomed volume, pressing on structures adapted to compressed dimensions. Hanging for 30 seconds produces a miniature version of the microgravity effect. Partial decompression, partial rehydration, without the overcorrection that zero gravity produces, because body weight limits the traction force to roughly 2/3 of the gravitational load, rather than eliminating it entirely. Sensation after releasing the bar is specific and recognizable. The spine feels longer, the lower back feels open, and the first few steps on the ground feel different because the disc height increase changes the mechanical relationship between every vertebral segment. The feeling fades over the following hours as gravity recompresses the discs, but the fluid exchange that occurred during the hang has delivered nutrients and removed metabolic waste from the disc interior, a maintenance cycle that sitting and standing cannot provide because they never remove the compressive load. Intervertebral foramina, the bony openings through which spinal nerves exit the vertebral column, widen as the vertebral bodies separate. The size of these channels depends directly on disc height. Hydrated, thick discs produce open foramina. Compressed, dehydrated discs produce narrowed foramina that can compress the exiting nerve root, producing radiculopathy, pain, numbness, or weakness radiating down a limb. Hanging opens the foramina by increasing the distance between adjacent vertebrae. The nerve root receives more space. The mechanical compression is reduced. This is the principle behind clinical spinal traction used in physical therapy. The difference is that a pull-up bar provides 60 to 65 kilograms of traction for free. The viewer who has mild radiating discomfort in the leg or arm that worsens by evening and improves by morning is observing the compression. Decompression cycle operating on a nerve root. The nerve is squeezed by daytime compression and released by nighttime compression and released by nighttime rehydration. Hanging provides the release during the day, hours before the overnight decompression would arrive. Safety distinction, severe disc herniations, spinal stenosis from bony overgrowth, and foraminal stenosis from osteophytes may not respond to traction and in some cases could be aggravated. Anyone with diagnosed spinal pathology should consult their physician before hanging. But mild morning stiffness, occasional radiating discomfort, and the general spinal compression of a desk-based life respond to 30 seconds of traction through foraminal opening. Relief that lasts for hours as the partially rehydrated discs maintain the increased spacing. Well, the shoulders, because the capsule physics changes everything about why the overhead reach disappeared. Glenohumeral joint has the greatest range of motion of any joint in the body, achieved through a loose joint capsule that permits movement in every direction. But the capsule is a biological tissue that remodels based on the positions it occupies. A shoulder that lives below horizontal, typing, driving, eating, reading, every desk-based activity, has its inferior and posterior capsule chronically shortened. The tissue tightens. The range narrows. The overhead reach that was effortless at 25 becomes restricted at 55. Hanging places the shoulder in full flexion and external rotation, the position that maximally stretches the inferior glenohumeral capsule. Under sustained load, body weight, the capsule undergoes viscoelastic creep. The capsule physically lengthens. Clinical observation suggests that regular dead hangs can recover overhead range of motion and reduce impingement symptoms. The proposed mechanism being inferior capsular stretch, allowing the humeral head to glide inferiorly, reducing subacromial impingement and addressing the structural cause rather than treating the symptom. If you cannot reach the top shelf without shoulder pain, you are experiencing capsular contraction from decades of arms, below horizontal positioning. The capsule shortened because it was never taken to its full length. Hanging loads it at maximum length. The creep that follows is the reversal of the contraction, millimeter by millimeter, session by session. The first hang may produce 10 degrees of additional overhead range. Consistent daily hanging accumulates the creep into a sustained range increase that the shoulder maintains between sessions. Frozen shoulder, adhesive capsulitis, is the extreme version. The capsule has not just shortened, but formed adhesions that restrict movement in every direction. Hanging cannot break established adhesions. That requires clinical intervention. But for the far more common pattern of progressive range loss from disuse shortening, the physics of hanging is the physics of capsular restoration through loaded stretch. Evolutionary dimension reframes why the shoulder joint is built this way, and the reframe changes what hanging means. Humans are brachiators. The glenohumeral socket is shallow, far shallower than the hip socket, because our primate ancestors swung from branches. The extreme range of motion the shoulder permits exists because the joint was engineered for overhead loading, reaching, hanging, swinging, climbing. Every great ape brachiates. The rotator cuff, 4 muscles wrapping the humeral head, Exists to stabilize a joint that sacrificed bony constraint for mobility. Exists to stabilize a joint that sacrificed bony constraint for mobility. The loose capsule exists because a tight capsule would prevent the overhead movement the skeleton was designed around. Humans stopped brachiating. The overhead movement disappeared from the daily repertoire. But the joint's engineering did not change. The shallow socket, the loose capsule, the rotator cuff's stabilization architecture all assume regular overhead loading that modern life eliminated. The shoulder impingement, the capsular contraction, the rotator cuff weakness that develop after 50 are the consequences of an engineering design operating without the input it was built to receive. The hang returns the input. The shoulder joint recognizes it the way the foot recognizes walking. The movement the structure was designed around returned after decades of absence. And then, the grip, because this passive action is simultaneously training the measurement that predicts how long you will live. Hanging for 30 seconds is a grip endurance test. The forearm muscles, flexor digitorum profundus, flexor digitorum superficialis, and the smaller finger flexors must sustain isometric contraction against your full body weight for the duration. For 75 kilograms, each hand sustains approximately 37 kilograms of force continuously. Every 5 kilogram decrease in grip strength predicted a 17% increase in cardiovascular mortality across 139,691 adults in the Lyon study published in The Lancet, a stronger predictor than blood pressure or body mass index. Grip strength predicts death because it tracks total skeletal muscle mass, neuromuscular integrity, hormonal status, and systemic inflammation simultaneously. It works as a predictor because the systems that maintain grip are the systems that maintain survival, and grip is the easiest way to measure all of them at once. Dead hang trains the measurement. Every second of hanging is isometric grip training at a load that exceeds what any daily activity demands. Someone who can hang for 30 seconds has grip endurance. Someone who cannot hang for 10 seconds has identified a deficit in the measurement. The mortality data says matters most. That correlation, grip strength predicting death more reliably than blood pressure, is the number I check every time the bar is overhead and the seconds start counting. There is a second mechanism in the same region. Hanging places the wrists in full extension under body weight, stretching the wrist flexor muscles that decades of typing, driving, and phone use have chronically shortened. The carpal tunnel, the narrow bony channel at the wrist through which the median nerve passes alongside 9 flexor tendons, opens during wrist extension as the transverse carpal ligament is tensioned and the flexor tendons are pulled taut. Waking with tingling or numbness in the thumb, index, and middle fingers, early carpal tunnel syndrome may respond to the hanging position because it stretches the structures that are compressing the nerve during the other 23 hours and 59 minutes when the wrists are flexed over a keyboard or curled around a phone. A second neurovascular compression operates higher up in the thoracic outlet, the narrow space between the collarbone and the first rib through which the brachial plexus and subclavian artery pass on their way to the arm. The scalene muscles in the neck and the pectoralis minor in the chest shorten from desk posture. The forward head, the rounded shoulders, the arms in front of the body position that every desk worker maintains for hours. The shortened muscles compress the thoracic outlet, reducing blood flow and nerve transmission to the hand. Tingling, numbness, coldness, and weakness in the fingers, symptoms that overlap with carpal tunnel and are frequently misdiagnosed as such, may originate at the thoracic outlet rather than at the wrist. Both the scalenes and the pectoralis minor stretch under body weight. The overhead position lengthens the muscles that desk posture shortens, opening the thoracic outlet and decompressing the neurovascular bundle. If you experience hand tingling during desk work that resolves when you raise your arms overhead, that immediate relief is the thoracic outlet opening as the compressing muscles lengthen. The hanging position sustains the opening under load, providing equivalent decompression for 30 seconds that the arm's overhead position provides for the moment it takes to reach for a high shelf. You now know what hanging does below the hands. The spine decompresses, the shoulders open, the grip trains, the carpal tunnel and thoracic outlet decompress. The question changes. What happens between the shoulders and the spine during those 30 seconds In the thoracic cage, that desk work has been locking shut for years. Now, the thoracic spine, because this is the region that determines whether you breathe fully or partially during every minute of the day. The thoracic spine, the 12 vertebrae between the cervical and lumbar regions, stiffens progressively with age and desk work. The vision discussion described how thoracic kyphosis deepens during desk hours, rounding the upper back, compressing the rib cage, limiting diaphragmatic excursion. Hanging is the most direct mechanical reversal of that compression. Under traction, the thoracic spine moves into extension under axial traction, a combination that opens the facet joints, stretches the anterior longitudinal ligament, and mobilizes segments that seated posture has locked in flexion. The rib cage elevates. The ribs, which attach to the thoracic vertebrae posteriorly, are pulled superiorly and laterally. The intercostal spaces widen. The thoracic cavity volume increases. Each breath during a hang reaches alveoli that were compressed during hours of forward flexed sitting. The diaphragm's costal attachments are stretched, increasing the excursion available for each breath. First deep breath during a hang feels different from any breath taken while sitting. Deeper, wider, reaching lung regions. The seated thorax had compressed closed. The viewer who takes 3 to 5 deep breaths while hanging is performing thoracic mobilization and respiratory rehabilitation simultaneously. The traction opens the segments, and the deep breathing maintains the range the traction created. Latissimus dorsi, the largest muscle in the upper body, spanning from the lower thoracic spine and iliac crest to the humerus, is loaded at its full length during a dead hang. In desk-based posture, the lats are chronically shortened, contributing to the rounding of the upper back by pulling the shoulders downward and inward. Hanging stretches the lats under body weight, the longest, most loaded stretch the muscle receives in any common activity. The release of the chronically shortened lats allows the shoulders to sit further back and the thoracic spine to extend more easily between hanging sessions. Hanging challenges the proprioceptive system in a way that no ground-based activity replicates, and the challenge connects directly to fall prevention for anyone over 65. When body weight transfers from the feet to the hands, the entire loading vector reverses. The vestibular system, calibrated to interpret gravitational force through the feet and the pelvis, receives input from a configuration it rarely encounters in adult life. The cerebellum must process a body-in-space relationship that ground-based movement never demands. The proprioceptive receptors in the shoulders, wrists, and fingers, rarely loaded under full body weight, must provide the position and force information that the feet and ankles normally supply. This novel position processing is a training stimulus for the balance and spatial awareness systems that determine fall risk. The brain that encounters only ground-based, feet-down loading patterns allocates its processing resources to those patterns exclusively. The brain that also encounters overhead-loaded, hands-up patterns maintains broader proprioceptive mapping, a wider repertoire of body position processing that transfers to unexpected perturbations. Hanging daily trains the balance system through a novel input channel that walking, standing, and stair climbing cannot access. And then, what changes after 45? Because force systems converging makes the hang more valuable with each decade. Disc dehydration accelerates after 40, proteoglycan content declines, overnight rehydration becomes less complete, cumulative height loss begins. Shoulder capsular stiffness accelerates after 45. The overhead range narrows year by year. Grip strength declines 3 to 8% per decade after the peak. The mortality predictor weakens. Thoracic kyphosis progresses. The forward curve deepens. Breathing becomes shallower. Rib mobility decreases. Dead hang addresses all four simultaneously through a single 30-second passive action. Spine decompressed, shoulders stretched, grip loaded, thoracic spine mobilized. No other single common action simultaneously addresses all four of these age-related declines. The 30-year-old who hangs is maintaining. The 55-year-old who hangs is reversing. Observation that reveals the physics most clearly is watching a child on monkey bars. Children hang, swing, climb, and brachiate without instruction. The overhead position is a natural part of their movement vocabulary. The shoulder capsule stays long because it is regularly loaded at full length. The grip stays strong because it is regularly challenged by body weight. The thoracic spine stays mobile because the hanging position regularly extends it. The discs stay hydrated because the axial traction of hanging and climbing provides regular decompression between the compressive loads of standing and sitting. At some point in adolescence or early adulthood, the overhead movement disappears from the daily repertoire. The bar is abandoned, the capsule shortens, the grip weakens, the thoracic spine locks. The discs lose their daytime decompression window. The decline that the 55-year-old attributes to aging began not with a biological clock, but with the removal of a movement pattern, the overhead hang, that maintained four systems simultaneously, abandoned decades ago without replacement. Fear barrier is real and worth naming, because many adults over 50 have not supported their body weight from their hands in decades. The grip feels uncertain. The shoulders feel tight. The position feels precarious. The partial hang addresses this directly. Feet remain on the ground, knees bent, arms overhead gripping the bar, a controlled percentage of body weight transferred to the hands. The body learns the position gradually. The grip adapts to the load over days. The shoulder capsule begins its creep response from the first session. The spine receives proportional decompression based on the percentage of weight transferred. Someone who begins with 30% of their body weight on the bar and 50 seconds of hanging is receiving more total decompression than someone who hangs full body weight for 5 seconds. Duration times load determines the rehydration volume, and a longer partial hang can exceed a shorter full hang. Osteoporosis requires specific caution. The traction forces are applied through the vertebral column, and severely osteoporotic vertebrae may be vulnerable to compression fracture under the axial loading that gripping produces at the shoulder. Anyone with diagnosed osteoporosis should discuss hanging with their physician. But osteopenia, the pre-osteoporotic state of reduced bone density, may actually benefit from the loading stimulus, because bone responds to mechanical load through the piezoelectric and mechanotransduction pathways that increase osteoblast activity. The traction force on the spine is a loading event. The bone reads as a signal to maintain density. The physics that makes weightlessness dangerous for astronaut bone density operates in reverse, during a hang, where the gravitational traction provides the mechanical stimulus the bone requires. Protocol matters, because the logistics determine whether anyone actually does it. Any horizontal bar, pull-up bar in a door frame, playground equipment, a tree branch, a beam in a garage. Grip with both hands, shoulder width or slightly wider, hang. Lift the feet from the ground. Let the body weight decompress the spine, stretch the shoulders, load the grip, and open the thorax. If grip fails at 10 seconds, that is the measurement. Grip endurance of 10 seconds on the body weight is the starting point. Build by 5 seconds per week, the grip strengthens, and the hanging duration extends. The spinal decompression increases with duration because the osmotic rehydration of the discs is time-dependent. Longer hanging provides more fluid exchange. Timing, ideally in the afternoon, when spinal compression is maximal. After sitting for extended periods. After exercise that loaded the spine. Squats, deadlifts, running. Whenever the body has been compressed and the discs are waiting for the load to be removed. Partial hanging, feet on the ground, knees bent, arms overhead gripping the bar, allowing partial body weight to traction the spine, provides a starting point for anyone whose grip cannot sustain full body weight or whose shoulder range does not yet permit full overhead position. Traction is proportional to the percentage of body weight transferred to the hands. Even 50% of body weight, 37 kilograms for a 75 kilogram person, provides significant spinal decompression and begins the capsular creep in the shoulders. The progression from partial to full hanging follows the same principle as any progressive loading. Start where the body can sustain the position. Increase the load as the tissues adapt. Breathing during the hang, slow, deep, deliberate. Each inhalation expands the thoracic cavity against the traction, loading the intercostal muscles eccentrically and increasing the mobilization of the thoracic segments. Each exhalation allows the traction to pull the spine slightly longer as the respiratory muscles relax. The breathing is an active component of the thoracic mobilization, and holding your breath during the hang misses the respiratory dimension entirely. Scapular engagement question. Should the shoulders be relaxed into a full passive hang, or should the scapulae be slightly retracted and depressed? Both positions have value. The full passive hang maximizes the inferior capsular stretch and the spinal traction. The body hangs as dead weight. Gravity provides maximum decompression. The scapular engaged hang activates the lower trapezius and serratus anterior, the muscles that stabilize the shoulder blade against the rib cage and that weaken from the desk posture that shortens the capsule. Alternating between passive and engaged, 10 seconds passive, 5 seconds engaged, repeat, trains the stabilizers while still providing the majority of the hang's decompressive benefit. That convergence. 4 systems simultaneously receiving the opposite of what 16 hours of upright, forward flexed arms below horizontal, gravity compressed living has been delivering, is why the bar is the one thing in the day. I refuse to skip now that the traction physics, the capsular creep, the grip data, and the thoracic mobilization sit inside a single passive action. 30 seconds. Both hands on a bar, feet off the ground. The spine that compressed all day decompresses. The shoulders that live below horizontal visit the range they have not used since childhood. The grip that predicts how long you will live is loaded against your full body weight. The thoracic cage, that desk work, locked in flexion, extends under traction while each breath reaches alveoli that have been compressed since morning. You are doing nothing except holding on, and every structure between your hands and your feet is receiving the reversal of the force it has been absorbing since you stood up.